is how long is too long to be outside with temperatures freezing or close to freezing?
It's honestly a little difficult to answer for everyone because it really depends on a lot of different things. It can depend on the level of clothing. It can depend on the type of cold. For example, today it's kind of raining and cold. So if you're near freezing and you're wet, you're much more likely to be hypothermic than if you're dressed well and in even colder temperatures and dry. Um, if you are in negative temperatures, as in below zero, we say about 30 minutes of exposed skin can cause frostbite, but you can get hypothermia much sooner than that.
So, speaking about hypothermia and frostbite, what are the differences between the two, and what are the signs and symptoms that you can look out for?
Sure. Frostbite is actually freezing of the tissues. And some of the signs that you would see would be literally like at first redness and tingling, things like that. And usually the extremities, like the fingertips, the ears, the tip of the nose, your toes, parts that stick out basically, and that are exposed to the air are more likely to have frostbite. And later signs, you can actually turn white, and then late signs, it can turn like a purple or black color.
And I am actually just gonna get my phone out and record it just in case something happens with the recording on Zoom. So
Sure.
my next question is, are there specific ages like children or elderly that the cold may affect even more?
Absolutely. Small babies that aren't as mobile can definitely be affected more by temperatures, and elderly, especially elderly who aren't very mobile, are more affected by temperatures. In fact, they found that sometimes even in homes, elderly folks, well, and babies too, but we see it more in the elderly, that even temperatures set in the winter of a heat of 62 in their homes is just too low and they can become hypothermic.
And so this is just an off question. You said you were used to the cold. What state are you from?
Well, I'm from West Virginia, but I lived in Iowa for 9 years prior to moving to Texas.
So you are.
So I've lived in snow and mountains, and then I moved to the cold. So I've lived in, yeah, now I'm going to learn how to deal with heat because
Yeah, no, definitely. So in the event of icy conditions, can you please discuss the risk of slip and falls and seriousness of resulting injuries?
sure. Wintertime is one of the biggest time for hip fractures in elderly because it is so hard to walk on ice. It's hard for people who are very stable on their feet, let alone if you're a little unstable on your feet. So if you have to be out, I would recommend if it's icy and you're not a very stable walker, you use an assist device like a walker or a cane or the arm of a person that can be with you. If you can avoid going out in those conditions, that's even better. But slip and fall prevention as well. We can wear better shoes. We can do good tread on the shoes rather than something like a dress shoe with a slick bottom. And if you see patches of ice, obviously avoid those.
And what are some of those better shoes? Are boots okay? Probably not heels.
Yeah, a non-heeled flat boot with good tread. I mean, where I'm from in West Virginia, we called them snow boots. But a hiking boot or a boot like a work boot that has good tread, that would be a good snow boot here or a good winter boot here.
Definitely. What are some of the precautions that people that work outside should be taking when it comes to the cold?
It again, it depends on how cold, but we always recommend dressing in layers. The bottom layer should be something that wicks moisture away from the skin. As much as we like natural fibers like cotton, cotton is actually not the best thing to have right against your skin because it holds moisture. So something like I hate to use brand names, but like an Under Armour fabric. Those moisture wicking athletic fabrics are really good as a bottom layer. And then multiple layers on top, just depending on how cold it is and how cold you tolerate. It's also important to cover your head because your head's a big area that you can lose body temperature from. So having on a hat, like it depends on what part of the country you're from as to what they're called. I think here they call them a knit cap or stocking cap. Um, in West Virginia, it's called a toboggan. is what we call the stocking cap, but a scarf or some kind of warm hat, and cover the ears as well, because ears are also at risk for frostbite in really cold temps. You can protect your neck with a scarf or a neck covering like a gaiter. And then it's important to protect your hands and feet. Hands, if you're working, probably more of a glove. And again, you can wear layers of gloves. And on feet, we recommend layers of socks. But you also don't want anything to be too tight, because it's important as frostbite prevention that you also have good blood flow. And if you're wearing really tight socks, you're not going to have as much blood flow to your toes.
And so those are all my questions. So I know your time is precious. If you have anything else to add, I was just wondering if maybe you did.
I would say for kids like waiting at the bus stop, or kids that have to walk to school, not everybody here owns a winter coat. And that's okay, because our temps aren't terribly low most of the time, but it's important for those children to be dressed in layers as well. If they have like an extra oversized hoodie, they can wear several layers of shirts underneath, and that can take the place of a winter coat in the cases where a child wouldn't have something like that. I would not recommend that they wear like little dress shoes or flip-flops or anything like that on those walks to school. They need to have on like their tennis shoes, or again, a boot, something like that, especially if they have to wait outside or walk a long way.
Yeah, definitely. That'll be good for parents to know, to let their kids know. And thanks again for your time. I really appreciate it.
Anytime.
Dr. Morales, if you don't
Yes.
mind, I think one more thing we can also mention is for people who may have doctor's appointments like during this cold time and they're just not comfortable getting out in the cold, to kind of let them know about our virtual visit option. So that way, you know, if they still want to keep those appointments, just to let them know that that's kind of an ongoing thing that we've been doing. And they always have the opportunity to have, you know, a lot of things that can be treated virtually. They don't necessarily need to go in person for.
Okay, sure.
Perfect. Thank you.
Yeah. Do you need to ask me the question, or we just give you the answer?
Yeah, just give me the answer. Just tell me a little bit about, you know, your virtual options and why it would be important to, you know, do that, so that way elderly don't have to go out in the cold.
Sure. And during these cold times, sometimes it's really difficult to get out of the house. And like we talked about, we want to prevent falls and things like that during the icy conditions. And we want to prevent cars on the road whenever the roads aren't very clear. So things like doctor visits, a lot of times there are virtual visits available. For example, at our office, we offer visits. We call it a tele health visit, and we can do those via phone or via video through like Zoom. And it can be a good visit. And other than hands-on exam, really you can see your doctor face to face and talk about any of the problems you'd plan to talk about otherwise. So that's a great option for doctor visits. And like I said, and a lot of companies are now going to that. So it's an option for most of us now.
Perfect. Thank you so much.